Assalamualaikum and greeting doctors. The chosen disease for our group is diabetes mellitus type 2. Below is the list of group members. Diabetes mellitus type 2 is a chronic metabolic disorder characterized by high levels of sugar or glucose in the blood. Diabetes mellitus type 2, which also known as non-insulin dependent diabetes mellitus, NIDDM, usually occur due to genetics and lifestyle. For example, unhealthy diet and lack of exercise. Unlike type 1 diabetes, which is typically diagnosed in childhood and involves the immune system attacking insulin producing cells, type 2 diabetes often develop in adulthood, especially those over the age of 35. This occurs because the body cells become resistant to the effects of insulin, the hormone responsible for regulating blood sugar levels. Diabetes type 2 often associated with obesity. The excess fat causing body tissue not longer sensitive towards insulin, thus increase the blood glucose. So, the pancreas will increase the production of insulin to fulfill the constant demand. But this can stress the insulin producing cells, known as beta cells, which lead to a decline in their ability to produce sufficient insulin. This causes insulin resistance, which reflect the clinical symptoms of diabetes, such as increased thirst, frequent urination, and fatigue.
For the normal signaling pathway of protein kinase B or AKT, insulin binds to the alpha subunit of the insulin receptor and activates the tyrosine kinase in the beta subunit. Once the tyrosine kinase of insulin receptor is activated, it promotes autophosphorylation of the beta subunit. The RTK will then phosphorylate the IRS protein, and phosphotyrosine residues on IRS protein become good targets for the P85 regulatory subunits of P13 kinase. The activated P13 kinase produces PIP2 and PIP3. PIP3 becomes the docking site for both PDK1 and AKT. Activated PDK1 then partially phosphorylates AKT, that later becomes the target of mTOR that going to phosphorylate AKT and fully activates it. AKT mediates most of insulin's metabolic effects, including regulating glucose transport by activating AS160 that cause translocation of GLUT4 to the membrane, glycogenesis, glycolysis, lipid and protein synthesis. AKT also regulates gluconeogenesis by phosphorylating FOXO, thus inhibiting the transcription of gluconeogenic enzymes PEPCK and G6 base. Mutation or any abnormalities in the signaling pathway of protein kinase B or AKT could lead to diabetes mellitus type 2. In the mutation of the kinase domain of AKT, the mutant kinase was unable to phosphorylate downstream targets, leading to the impairment of insulin activity, thus developing insulin resistance. The mutation of IRS protein, the substrate for the insulin receptor, causes the AKT signaling pathway to cannot be activated, while increased in serine phosphorylation of IRS protein reduce the ability of IRS proteins to attract P13 kinase, thus minimizing its activation. It could also accelerate degradation of IRS protein, decreases IRS tyrosine phosphorylation, thus impairing downstream effectors. The fasting hyperglycemia in patients with type 2 diabetes is the clinical correlate of the increased glucose production by liver because of insulin resistance. This is the result of the lack of inhibition of the two key gluconeogenic enzymes, PEPCK and G6 base, due to the decreased phosphorylation of FOXO that caused by the reduction of AKT activity. This allows the FOXO protein to enter the nucleus and activates the transcription of these rate-controlling enzymes of gluconeogenesis. Disruption in the balance between the amounts of the P13 kinase subunits may lead to insulin resistance. Increasing the expression of P85 alpha subunit will affect the ability of insulin to stimulate the association of the P85 P110 heterodimer with IRS1, thus reducing the P13 kinase insulin signaling.
Clinical manifestation of diabetes mellitus. There are six types of tests that can be taken to diagnose diabetes mellitus. These are the tests taken to diagnose diabetes mellitus. The first one is glycosuria, which is a glucose urine test, a basic test that is taken on a strip which measures the presence of glucose in urine when high concentration of glucose. Further tests are needed for a positive result. The second test is random blood sugar test, which is only taken when high blood glucose level and need to measure blood glucose level when after fasting as a further test. The third test is fasting blood sugar test, which measure the blood glucose level after fasting for a night. If the glucose level is more than 130 mg per dl, the individual is diagnosed with diabetes. The fourth test is 2-hour postprandial test, which measure the blood glucose level after 2 hours consuming carbohydrate or glucose. If the blood glucose level is more than 200 mg per dl, the individual is diagnosed with diabetes. The fifth test is glucose tolerance test, which require fasting for 10 hours. The individual need to fast for 10 hours and the blood glucose level is measured. Then the individual was given glucose. The After consuming the glucose, the blood glucose level is measured each 30 minutes for 3 hours. Then the value are compared to a tolerance curve. The last test is glycated hemoglobin test, which measure the percentage of HbA1c against total HB to determine the diabetes. And this also is used for monitor the treatment and study drug effects during treatment. Therapeutic targets in diabetes mellitus. The first one is AMP activated protein kinase AMPK. AMPK plays an important role in development of insulin resistant and diabetes mellitus type 2 by stimulating catabolic pathways for producing ATP and inhibits anabolic pathways. It increases glucose uptake by inducing glucose transporters by increasing GLUT4 expression and translocation as well. AMPK activation, either physiological or pharmacological, can prevent or ameliorate some of the pathologies. Numerous physiological, pharmacological, natural, and hormone activators of AMPK are known. Some of these are currently used clinically for the treatment of T2D, diabetes mellitus type 2, which, for example, metformin and thiazolidinediones.
Thiazolidinediones, known as glitazones, are medications that manage diabetes mellitus type 2. Thiazolidinediones function by regulating gene expression through binding to peroxisome proliferator activated receptor gamma, a nuclear transcription regulator. Peroxisome proliferator activated receptor are a family of ligand-activated transcription factor of nuclear hormone receptor that regulate energy homeostasis. The genes activated by PPAR gamma subtype are present in muscle, fat, and liver, regulating glucose metabolism, fatty acid storage, and adipocyte differentiation. The binding of TZT will induce a conformational change to alter gene expression of numerous pathways involved in metabolism regulation, including lipoprotein lipase, glucokinase, fatty acid CoA synthase, and others. PPAR gamma agonists improve insulin resistance by increasing adiponectin, GLUT4 expression, and opposing the effect of TNF-alpha in adipocytes. Adiponectin is a cytokine secreted by fat tissue, increases insulin sensitivity, and fatty acid oxidation increase with TZD therapy. Increased GLUT4 expression will increase glucose uptake in adipocytes and skeletal muscle cells in response to insulin. In addition to their function in glycemic control and improvement of insulin resistance, TZDs potentially have anti-inflammatory and anti-cancer properties. And TZDs have serious side effects including a greater chance of heart failure and fractures. That's all from us. Thank you for watching.